We're very happy to welcome one of our most popular experts here at CFUN 1410 AM. I've gone through his resume over and over again. I'll go through it again because it's very impressive. Stints at the Faculty of Child Psychology at the University of Ottawa before he lectured in psychiatry at Harvard, and he did so for 7 years before moving here to Vancouver. And now he's become one of the leaders in the field of biofeedback and neurotherapy, which is the medical science of adjusting brain waves. We're very lucky to have him here in Vancouver, and he's happy to answer any questions you have today. But we're going to talk specifically about emotional difficulties in children. That's our subject today. It's Dr. Paul Swingle, and this is It's All in Your Head. Hello, doctor.
Good morning.
We get a lot of phone calls about children on this program, and it's one of your real specialties. You seem to have a bit of a passion for helping children.
Yes, we see a lot of children in my practice. Probably a third of the client population are kids. Anything from learning problems, attention problems, and all of the emotional difficulties and conduct and behavior problems that kids have.
We're going to talk about the causes of those emotional difficulties, some of the symptoms that you can look out for, and of course, most importantly, the treatment of kids, and hopefully it's not through medication. And we're going to talk a lot about medication throughout today's hour. First of all, though, let's talk about neurotherapy, a great solution, one of the best bargains in medicine, as you've always said before. What exactly is it, and how does it work?
Basically, what we do is have a look at the way the brain functions. What we use to assess brain function is the electroencephalograph. That's a standard EEG. Some folks may have had some exposure to it. If they had a head injury, they might do an EEG. And what you're looking at is brain function. After we do an electroencephalograph, we can see areas in the brain that are not working efficiently. And these inefficiencies are related to certain kinds of symptoms, such as depression, learning problems, involuntary movement disorders like epilepsy, sleep problems, anxiety problems, and so forth and so on. The really dynamic thing about neurotherapy is that we teach the individual how to correct their own brain activity. Brainwave biofeedback is a self-regulation procedure. You learn how to regularize brain activity. There are several ways that we do this. The backbone of treatment is brainwave biofeedback. We set it up so that when the brain is doing what we want it to do, you'll hear a tone or see something move on the computer screen, and you make use of that information, which you can't possibly feel. You can't feel the effects of that, but you can use that information to learn how to self-regulate. If you're a child, we set it up so that you can run electric trains with your brain or play a video game with the brain. We have some other techniques that we use for autistic children who can't really participate early in treatment, which are more involuntary. But the purpose of what we do is to normalize brain activity. The other side of it is peak performance training. The secret weapon of the World Cup soccer winners, the Italian team, was neurotherapy. A friend of mine in Montreal got them set up. Every man on the team did neurotherapy. It was considered their secret weapon. It was written up in the Financial Times, Wall Street Journal, and so forth.
The degree of how long somebody needs treatment varies from person to person, I'd imagine, and for how long the problem's been around for. Would that be accurate?
Absolutely. Chronicity is a big issue. How long have you had it? What kinds of things have you done to yourself? For example, if you've medicated yourself, you could have exacerbated the problem, made it worse. So it might take somewhat longer. If it's a simple problem like simple ADD, for example, and it's a young child coming from a loving family, and the child understands that the parent's love has nothing at all to do with her achievements, those clients come from heaven. They're out of there in 10 or 12 sessions. A guy your age, different issue.
Yeah, well, especially when you let sleep problems go on for so long, which is how I actually met Dr. Swingle. When the person first comes to the clinic, obviously they don't really know what to expect. I didn't know what to expect either. And all Christina said was, well, he does brain mapping. I had no idea what that was. But you can literally tell that person by looking at the ratios and the feedback what the issues they have.
That's right, why they've come to see me. I don't ask them why they're there. I do the brain assessment, which doesn't take very long, and right on the spot, we'll go over the data together, do the calculations together, and I'll show you that, for example, there's a deficiency in this area of the brain and the way the brain is functioning, and that's associated with depressed mood states. Are you prone to depression? It would be that kind of thing. And the client either verifies or says that that's not me, but that's very rare. Our hit rate is extremely high with this sort of thing because we're looking at brain inefficiencies. And, the client has come to see us for some reason. They're not there to play around.
Now, you have had a lot of patients and clients come through and a lot of success stories. I mean, this is obviously what keeps you going. You've even added another practitioner, Dr. Terry Rowe, who's got a lecture coming up. We'll tell you about that a little later on. You must hear all the time from parents or kids who have come in with some kind of issue and are now fully healed for good and are doing really well.
Yes, that happens all the time. I was at a workshop yesterday, actually, and a couple of parents came over to me, and we had treated their children 8 or 10 years ago, and they're in university and doing this, that, and the other thing, all very happy with the way the child progressed. Once you correct some of the inefficiencies in brain functioning and keep the kid off these psychotropic meds, then the developmental process kicks in, does our work for us. We don't have to do anything.
You told us a story once about a young girl, I believe, who had trouble playing the violin, or she was having some trouble in school, and she managed to actually play you the violin.
Yes, that's one of my favorite stories of a client that's sent directly from heaven. She had ADD, and one of the side effects of ADD is it affects self-esteem. The child works so hard, and they can't make progress at the rate that they see their peers, and they conclude they're stupid. That's it in a nutshell. When you correct that, and they're able to function efficiently in school, and their work pays off for them, their self-esteem is corrected, and if you correct self-esteem, you correct everything. The story was she took her violin into class. She had started a new school. These were all new kids she didn't know. And she played a solo for the kids first week in class. And the mother said, last year that would have been impossible. Absolutely impossible. Now, that's not the ADD. That's the self-esteem.
Dr. Paul Swingle is here. You're listening to Experts on Call on CFUN 1410 AM. And our subject today is emotional difficulties in children. There are many, many reasons, many, many causes. We're going to go through those, the symptoms, and how you can go about curing your child of emotional difficulties. And if you have any examples or any questions relating to your child, and Dr. Swingle's clinic is on Melville Street in downtown Vancouver. We'll take a phone call in just a second. Staggering amounts of children between the age of 8 and 13 that take medication.
Yes.
Now, those are U.S. numbers you have here, but tell us how many kids they think are on medication.
It's overwhelming. The estimate is over 10 million, and that is about 20% are on some form of psychotropic brain-active medication. And it's interesting that they're medicated for conditions that have no objective tests. There's no test that will tell you that a child has hyperactivity disorder or schizophrenia or bipolar. It's all based on judgments. We're medicating the normal behavior of children, and we're using medication for behavior issues instead of parenting. So we're going to have a lot to say about a lot of that, and I'm sure that a lot of our listeners are alarmed by these numbers as well, and we'll be chatting with them, I'm sure.
Well, let's talk about the long-term effects of medication in just a moment. I want to take a phone call here. We're talking emotional difficulties in children, and we're chatting with Betta. Betta, thanks for calling. You're on with Dr. Paul Swingle here on CFUN 1410 AM.
Hi.
Hi.
Actually, I'm a 35-year-old woman. When I was a kid, I had a lot of emotional problems, such as I used to cry for every single thing. I was screaming. I couldn't keep any friend. And my parents at that time, there was not such a psychological advances, so they didn't know how to deal with me. So they were trying to be very kind, and whatever I want, just give it to me. But still, I have the same problem as an adult. I can't keep any friend, and I'm having the same aggressiveness, and I'm angry most of the time, and I can't control myself. And one of my supervisors, she said, I have a problem with the listening. I just choose to hear a half of whatever she is asking me, and I have lots of work problem too. I don't know how to deal with it with this age.
Mm-hmm. Well, you're not alone, first of all, Betta, and that doesn't sound highly unusual to some of the people that visit you.
That's right.
At the clinic.
Yes. It's difficult to know what kind of historical situation we're dealing with, whether Betta had some sort of emotional trauma as a child and so forth and so on. Actually, from a neurotherapeutic point of view, it doesn't really matter. The traditional psychodynamic ways of dealing with this would be to review all of the historical situations that might have given rise to it. The difference with neurotherapy is we look at the brain. The brain will tell us if there's a genetic predisposition to certain conditions or if there are some environmental effects. For example, trauma. We've had a couple of shows here on the effects of traumatic stress. In any event, the brain will show us if there's been an emotional trauma that's impacting brain activity. Now, my guess is in Betta's case, we're probably looking at a situation in which she has a deficiency of slow frequency in the back of the brain, so the brain can't quiet itself. That condition is also related to individuals who self-medicate. Alcoholics very often show that pattern. She also may well have a disparity in the way the frontal lobes are balanced. And when we find some of those disparities, they're associated with impulse control problems. The bottom line is we have a look at what are the areas of inefficiency, we normalize them, and then we work with Betta behaviorally to help her reestablish new behavioral patterns to correct those issues.
Hey, Betta, are you still there?
Yes, yes.
When you were younger, did you have a traumatic incident of sorts, or did something really awful happen when you were really young?
No, nothing. No, not at all. I mean, some people they have told me I've been just a spoiled kid. Mm-hmm. I don't know if it's such a distinct, or maybe I have really a physical problem in my brain. I don't know, but...
Well, one of the conditions we find with conduct disorder or defiance disorder is the child becomes highly disruptive because of a predisposition in the brain for impulse control. Parents don't know how to deal with that, and they do walk on egg parenting, meaning that they're so concerned about the child losing control that they respond to every whim that the child has. Now, that's bad parenting. Right. And what it does is exacerbate the problem. The problem won't go away if you ignore it and walk on eggs. And it sounds to me as though your parents tried to deal with you in that fashion, which is showing compassion and trying to respond to your impulse control issues.
Yes, that's correct. The other day I was counting the number of fights that I had from my age of like 6 when I remember. It came up to 46 times. I had fight with 46 different people. Mm-hmm. And most of them, they were my friend, my classmate in this school, even in a university, I mean, with my employer. And then I got totally disappointed with this, myself. I'm not married or anything, so I don't have, like, family life. I don't know if I would be married. I might be divorced maybe so many times.
Well, one thing, Betta, you have a great memory to be able to remember all those fights spanning over the years, so that's very encouraging. And listen, if you want to talk to Dr. Swingle, I'm going to give you his telephone number here, and you can always call us back if you don't have a pen, but it's 608-0444, 608-0444, and it's a really simple, relaxing, very reassuring process that you'll go through, believe me. Thanks very much for sharing your story. As we're talking about emotional difficulties in children, there you have an example of something that's stuck around for quite some time.
That's one of the issues, obviously, this notion that you're going to grow out of it. Very often the situation becomes rather severe. You don't grow out of it. A good example of that is a male with ADD that wasn't diagnosed and treated properly when he was a child. When he gets to the age of 40 or so, he usually is addicted to some sort of drug or alcohol, been through a number of relationships, can't hold down a job, defines himself as just an easygoing, laid-back kind of guy, and his life is going down the tubes big time. And the same is true with conduct disorders in children. The number of individuals in prison who have had these kinds of conditions as children is extraordinarily high. We did a program on that once before in which we reviewed some of those data. Now, the other possibility, of course, is a behavior problem may be associated with a head injury. And we can see that when we do a brain assessment because the imbalance in the frontal cortex may not be genetic. It may be a function of some sort of traumatic brain injury. Both of those are treatable with neurotherapy. The fact that it's genetic does not mean it's not treatable. The real issue in terms of children is to avoid this notion of labeling and medicating. As I pointed out, there are no objective tests for any of these things, and it's become popular to develop new and more interesting forms of disorders and call them diseases. and then talk about some sort of chemical imbalance in the brain. There's no evidence for that, zero. The notion that there's some kind of serotonin problem or neurotransmitter problem associated with some conditions, no evidence for that. Or there is some, but it's very minimal. The problem that we run into is that a lot of these drugs are extraordinarily dangerous and very toxic. In the United Kingdom, for example, antidepressants have been banned for the use of kids, period. The United States is really dragging their feet with regard to that, and Canada's kind of somewhere in between. A lot of the problems associated with the potential toxicity and danger of these drugs, the reporting to FDA is on a voluntary basis. So one of the estimates that the danger associated with heart deaths associated with Ritalin, they had something of the order of 186 deaths reported, and the guess is that this figure represents between 1 and 10% of the actual number of deaths. And if you look at the toxicities of some of these other medications, then it's very, very alarming. Now, another thing I'd like to put to bed is this notion that we have that the shootings and so forth that have been taking place in schools, if you look at the initial reaction to that, you hear that people say, if only someone had seen the symptoms and reported it to the authorities and had the child properly medicated. Okay, you hear that over and over and over and over again. The fact of the matter is, all of these kids had been identified. Most of them were on antidepressants. The most recent one, this fella, Jeff Weiss, his antidepressant was up the week before he was involved in the murder-suicide. So the notion that we're not identifying these people and medicating, it was just wrong. And it's being reported in places like the New York Times and so forth. But what you tend to hear is if we could only screen and medicate, the world would be a safer place. The really terrifying thing is Bush's, I forget what he's called it, the Freedom of Something initiative. What he wants to do is do mental health evaluations on all children and medicate any conditions that are identified. Now, if that doesn't give stupidity new meaning, I just don't understand. I don't know.
Well, it's funny because we talked about this before, is that it would be great if kids could have regular neurotherapy sessions during the first few years of school and identify any issues at that point and nip them in the bud. You talked about medication. What are some of the long-term effects of medication on some of these people?
Well, they're kind of serious. Sudden death, tardive dyskinesia, heightened suicidality, liver failure with Strattera. Adderall was withdrawn, fortunately, in Canada, but sudden death was a problem there. I think I mentioned Strattera and liver damage. Ritalin triggers OCD, manic episodes, tics. The new flavor of the month is using antipsychotics with kids, which drives me nuts in terms of using medication to control a behavior. But the side effects of that, risperidone, for example, bedwetting and weight gain, among other things. The bottom line is, there's a song, Try a Little Tenderness. There's another line in that for parents, try a little parenting. You don't run to your pediatrician or child psychiatrist and say, my child yells when he's not supposed to yell, or he's impulse control problem, or he's not controllable, and medicating that. If you just stand back for a minute and think about the absurdity of that, get a little help from a psychologist or a social worker or whatever, somebody who has some expertise in helping you with parenting. Get the school on board. The schools are really pushing the medication. They really like sedated normal behavior because it's much, much, much easier to deal with usually.
You're listening to It's All in Your Head here on Experts on Call. And if you have a question relating to emotional difficulties in children or perhaps any brain-related issue, Dr. Swingle is here live to answer your questions. The great thing about this type of therapy is that once it's fixed for good, and it's covered by extended medical, and of course treatments are tax deductible at tax time. You have so many kids that come into your practice, and some of them with emotional difficulties, some with these learning disabilities, and instead of the teacher saying they act out in class, let's medicate them, your notion is to give them the therapy that they need. But I'd love to know what the core issues are or the core reasons why children have emotional difficulties in the first place.
Well, there are a lot of reasons. The number one, I suspect, is the breakup of the nuclear family. children always respond to divorce, separation. And I find that gives rise to bad parenting because the child becomes kind of a pawn in the power struggle. And each parent trying to demonstrate how lovable they are will respond to the child's wants, not the child's needs. So we have a situation in which the child's not being adequately parented. The second contributor is TV and video games. We've had a couple of shows in which we've talked about this. The evidence is compelling, and there's no question about the evidence associated with this, that watching violent TV gives rise to aggressive behavior in children, which will isolate them. And they become isolated because of their aggressiveness. Their self-esteem suffers. They display behaviors associated with depressed mood states. Now, if we medicate that, what we're doing is sedating the problem, and the child is going to grow into an adult with continued difficulties and continued thinking that they have to medicate themselves because they're deficient in some way. That's the kind of dynamic that we have building up here. Children can have predispositions like anybody else. You have genetically predisposed alcoholics. What do they look like as kids? What they look like as kids are agitated. That's why people drink when they're predisposed to genetically based alcoholism. They're drinking to calm down. So what's that child going to look like? They go to their pediatrician or a psychiatrist, and the teacher is all upset that Johnny is bouncing up and down. Well, he has ADHD. Well, he doesn't have ADHD at all. He has a predisposition to alcoholism. And they sedate him as a young child, and he will become an alcoholic because they're not dealing with the issue. The issue is to normalize that area in the brain and help the parent in terms of how do you deal with a vigorous child.
And vigorous children are what children are supposed to be, isn't it, kind of?
Well, I love the quote of, I think his name is Dr. Bender, who's done a couple of articles and books. I'm trying to think of the exact statement that he uses, but it's something like, the wildest colts make the best horses.
True.
You know, the United Nations, in 1989, the Convention associated with the Rights of the Child, quote, children have the right to be protected from illicit use of psychotropic drugs, end quote. We're drugging 15 to 20% of our kids.
And we don't really even know, well, we sort of know, but what's going to happen in 15 to 20 years. And that's the other fearful thing about that. Let's talk a little bit about symptoms in just a second. I want to take a phone call. Let's get Colleen on. Colleen, you're on with Dr. Paul Swingle on CFUN 1410 AM.
Hi, Dr. Paul.
Hi.
God bless you.
Thank you.
For getting all this information out. I'm in a very difficult situation. I don't do pharmaceutical drugs, but I understand everything you're saying there, and I know that I can somehow get to your place. I can't go into a lot of it with you, but I could make an appointment to come to see you because I live in Nanaimo and a trauma survivor from surgical stuff, and I've had some of those antidepressants and some of them that have made me try to commit suicide, the Daravon in particular.
Oh, yes.
And I've had some serious injuries to my body, and I have complex post-traumatic stress disorder. And I can't go anywhere near a hospital because there's been so many mistakes on me, and all they want to do is drug me. And I took myself off 100 milligrams of morphine, but I almost killed myself in the process with no help. And I truly believe with your therapy that my brain can be repaired because of all the holistic work I've done so far the last 11 years. And I heard there on your program that you're a medical doctor. You're covered by the healthcare system, right?
No, that's not true.
Okay, I misunderstood it.
Yes, I'm a registered psychologist, and some extended medical plans cover psychology, and also as a registered psychologist, whatever is not covered is a tax-deductible medical expense, including your transportation from Nanaimo, by the way.
Thank you for saying that to me, because as it stands now, there's not a medical doctor that will even see me, although I did get some help in, I can't remember, months ago, but I've got a lot of trauma to my body right now. I'm sure you can tell by my voice. I'm all over the place, but I have a Oriental doctor that's working with me, and they're trying to get the ministry to change some of their policies for people like myself that can't be treated by the medical system, nor can I. I'm in the middle of a litigation anyway right now, so that's why the doctors won't even look at me. But I've got serious head injuries.
Yes.
And I wondered if there's any way I could phone your office next week.
Absolutely.
Yeah, well, I'll give you the number right now. Colleen, here it is. It's 604-608-0444, 608-0444, and you deal with traumatic brain injury all the time, and that's one of the things.
In fact, we're going to be talking about traumatic brain injury in the next program. Thank you so much, Colleen, for sharing that with us. Colleen's condition is one we run into a lot, in which the conventional treaters have just thrown up their hands and don't want to deal with her because she's so problematic. She's in litigation, and the only thing that they will do is medicate and sedate her. It sounds as though she has traumatic brain injury and a history of emotional trauma. You add those two together, it can give rise to conditions like fibromyalgia because the body simply shuts down. So now she's got three issues. Do they sedate? Well, she was talking about using morphine. Morphine probably for the pain associated with the fibromyalgia, antidepressants because of her depressed mood states and lack of interest and motivation, probably a sleep sedative. You can see how you can get into a situation in which it's just a horrible spiral down and down and down. The way we correct that is to start to modify brain activity so that we're bringing it into normative range. Now, Colleen is also a very good example of the fact that neurofeedback is not a standalone discipline. We have so many hobbyists out there, one size fits all. They're part of franchises in which they use exactly the same treatment on everybody. In Colleen's case, she's going to benefit from some work in terms of dealing with the emotional trauma, some behavioral modification procedures, probably sleep hygiene suggestions. It sounds as though she's working with a TCM, a traditional Chinese medicine fella, who's probably trying to work with some of the herbals to get her and keep her away from these dangerous medications. This is the kind of client we tend to see a lot of.
And she mentioned she was trying to get off morphine and nearly killed herself because of it. You got to be very careful when you come off some of these medications, don't you?
Oh, absolutely. The rebound and side effects and withdrawal can be horrendous.
You brought up a good point. Tax deductible to take the ferry and transportation to get to your clinic as well as the treatments.
Yes.
Now, you have a lot of out-of-town patients that come see you.
That's correct.
So do they sometimes come and they'll stay for 2 or 3 days and get a lot of treatments in that time, or how does that work?
Yes, depending upon what the condition is and how far the person has to come. We have people fly in from all over the world. In some cases, they'll come and spend 2 weeks, go back to Greece or London or wherever it is they're from. And then in 6 months, they might come back for another series. We have people who have moved here to receive treatment at our clinic. I don't mean permanently moved, but families in which one of the parents will move over here with the children and receive treatment for a year or so with us. Some of the conditions we deal with, for example, like autism, the autistic child has some emotional difficulties, obviously, but you have to deal with the autism first, and you correct the autistic symptoms, and then you can start to work with the child in the emotional arena. Now, they're deficient in that area in the brain associated with being able to learn some of the social interaction and social skills, so a lot of their emotionality is skill-based. So to treat them as a depressed client when in fact they need social skill training. But again, first order of business is what are we dealing with in the brain? What does it look like? Is the brain carrying an emotional trauma signature or traumatic brain injury or a genetic condition? Normalize that and then help the person with other kinds of treatments. Now, again, I don't want to give the impression that there's a knee-jerk reaction against medication. There are times when it's necessary, and we work with psychiatrists all the time in terms of this person needs some help to get from place A to place B. You know, we need a bridge. We look for the most forgiving drug that they can be titrated off very easily. The psychiatrists we use are not the guys who prescribe what the drug salesman has simply walked in the door with. You need a good psychopharmacologist, and there are plenty around.
Emotional difficulties in children. Our topic today with Dr. Paul Swingle from Swingle & Associates. SwingleandAssociates.com is the website, by the way. And before we talk about some of the symptoms of emotional difficulties in children, let's take another phone call, this time from Candy. Hey, Candy, thanks for waiting. You're on with Dr. Paul Swingle on CFUN 1410 AM.
Thank you very, very much. Dr. Paul, in regards to society's dynamic individuals, it seems to be there's a fine line between the gifted and those that need help, depending on who's assessing them. And I'm wondering if your methods can differentiate between those fine line assessments.
Very interesting question. We see a lot of children who are gifted, but also have some sort of behavioral issue, a mood condition, for example. One of the things that we discover when we do an assessment is we see strengths as well as weaknesses.
IQ, etc.
IQ and what I call the artist signature. And that is when a child is predisposed to have skills in the area of art, dance, architecture, mathematics, and so forth. So we identify those things, and we're cautious not to affect them when we're doing our other treatment. Another aspect of this, Candy, is some children who are very gifted end up in a lot of trouble because they're bored to tears in the school situation, and the school just doesn't know what to deal with them. So let's medicate them and control them.
Yeah, my concern is that we're losing our Nobel Prize laureates with our assessments. So thank you.
Thank you, Candy. That's a great question. Let's go to Lucille. Lucille, you're on with Dr. Paul Swingle on CFUN 1410 AM.
Yes. I go to not to Dr. Swingle himself. I go with one of his associates. And I know a gal that's had shock treatment, and I'm concerned that, is that anything that you do that would be the same or affect her in the same way, or I'm just concerned that, are you doing the same thing?
No, we don't do shock.
No, I understand that you don't do that, but...
Oh, you mean, does it have the same kind of deleterious effect?
Or whatever.
No. One of the concerns you have with shock treatment is it affects memory, for example. None of the treatments that we do have that kind of effect, because remember, what we're doing is pushing the brain towards more normative functioning. We're not using a toxicity to control something, which is what the medication does. It creates a toxic situation in the brain, or these huge magnetic fields that are passed over the brain. What it's doing is it's blocking out things. None of our treatments are focused in that direction. The best metaphor to think of in terms of what we're doing with the brain is what you do with your body with physical exercise. That you're trying to make particular areas stronger, areas that are somewhat weak, you strengthen, and the metaphor fits perfectly with what we do with neurotherapy. We normalize the brain, and then for some folks like professional athletes, we increase the efficiency of the brain.
I think a lot of people saw One Flew Over the Cuckoo's Nest and equate that with neurotherapy. They don't even do that anymore, do they? That electroshock therapy?
Oh, yes, they do. Yes.
Oh, okay. But that's not what you do.
That's correct.
And we're actually going to talk about a book you're putting together about neurotherapy shortly, and we will get to the symptoms of emotional difficulties in children in just a second, but we're getting a lot of great phone calls here. It's Experts on Call with Dr. Paul Swingle, and it's all in your head. When it comes to kids, and there's so many issues that could affect them, how do we know it's an emotionally driven difficulty? What kind of symptoms do they exhibit? You know, how will you tell that your kid maybe needs to see you?
Well, all behavior is associated with emotion, and a lot of it is normal. Anytime a child is going through some difficult period, parenting is the big issue here. Sit the child down and try to find out what's going on and what the child can do about correcting it and what you can do to assist the child. If a child comes to see us, what we do is we have a look at the brain and see what areas might be contributing to this problem, normalize them, and then have the child work with one of our specialists in terms of suggestions about developing peer relationships. What kind of activities do you like to get engaged in? How much TV are you watching? My suggestion to parents is throw out every TV in the place. The evidence is compelling. It's not doing the kid any good at all.
So if the TV's bad, what about video games?
No, out.
Wow.
For all kinds of reasons. I don't think there's a parent that's listening to me that isn't aware of the dangers associated with that. Try to get a kid away from his video game. How does he act? Okay. Does that sound like addiction to you? I don't have to say any more.
Let's talk to Leah. Leah, thanks for waiting. You're on with Dr. Paul Swingle, and it's all in your head on CFUN 1410 AM.
Hi there.
Hi.
I tuned in very late, and so I didn't know what your subject was. But I'm just calling to say that I was a patient of Dr. Swingle, and I went in to see him because I was suffering terribly with anxiety that I don't know where it came from, and he was able to determine that to the very first visit. Like, even though I couldn't put my finger on what it was, he said, just by measuring all my brain waves, he said, this is exactly why you're here. He knew exactly what to treat me for, and not sure exactly how many sessions I actually went for. I think it might have been 8 or 10, but I have suffered next to zero anxiety since, and it's been months and months now. So I am so grateful, and I just tell everybody I know.
An unsolicited testimonial. That is wonderful, Leah. So what kind of symptoms? You say anxiety, just have panic attacks, or what would happen to you?
No, it was just that ongoing sort of nervousness where I just felt nervous and my heart would palpitate and I would just feel insecure, and it was just like this horrible feeling that would just come over me, and I couldn't shake it and I don't know, I'd been having it for years, and I'd tried doing the drug method, but that just felt wrong, so I wouldn't do it, and I just sort of suffered through it. I tried psychotherapy, and, I didn't think it was really emotional, like there was no rhyme or reason for when it would come on. And so when they were able to measure it and just send me for those treatments, and it just kind of, all of a sudden I realized I wasn't having it anymore. It was amazing for me. So thank you very much, Dr. Swingle.
Nice.
Oh, thanks for for sharing that with us.
Did you have trouble sleeping too, Leah, just out of curiosity?
No, not really.
Yeah.
No.
Interesting. Well, that's really great to get that kind of a testimonial, and that's why you're here. That's why you like doing this.
That's right. Leah's a good example of a situation in which there was probably a mild inefficiency in the way the brain was processing something. She felt it physiologically. There's a situation of 8 sessions, and she's symptom-free and free of the meds, too.
Yeah, well, it was about 8 sessions for me and sleeping issues as well. And haven't had problems at all sleeping when I used to wake up at 2 in the morning and think and think and think. And then all of a sudden the alarm would go off at 4. And then you'd need a bellboy to carry the bags under your eyes around. You're writing a book. In fact, you've got 2 books now on the go about neurotherapy. Tell us about those.
Well, both of them have been accepted for publication by University of Rutgers Press, and I'm very, very happy with that. The first is written for parents and folks who would like to understand more about neurotherapy and what it can do for a wide range of disorders. The second one is my mission. I want to get neurotherapy into primary care so that when you walk into your physician's office, instead of the physician medicating a particular condition, they can do a few neurotherapy sessions and correct it. Now, they may use meds to help you get from place A to place B, but to use neurotherapy to normalize brain activity. And part of that is to try to get it into the schools. It's a very normal self-regulatory procedure, and there's some schools that have made use of my techniques in Yonkers, New York, and places of that nature. If a child's having an attention problem, rather than ship them off to me, they should go downstairs to their special services or whatever they want to call it and do a few neurotherapy sessions and be done with it.
It's very important, and you do say it all the time, that when you do go to get neurotherapy, you got to make sure that somebody is fully licensed to do so.
That's correct, yes. We have a lot of hobbyists around. They're franchise owners. One size fits all. They can be dangerous. If you're going to do neurotherapy, go to somebody who's licensed to practice some discipline, medicine, psychology, chiropractic. They bring other things to the table. And if they mess up your brain, they have something to lose, their license.
Dr. Paul Swingle's website address is swingleandassociates.com. That's Swingle, which is spelled S-W-I-N-G-L-E, and associates.com. And when you're back next time around in April, we're going to be talking about age-related issues.
Traumatic brain injury, stroke,
yes,
and
traumatic.
age-related declines, and how we can reverse and prevent them.
Well, thank you as always for your insights and your advice to our listeners, and we look forward to seeing you next time around.